Hello, my name is Alejandro Dick and I am going to talk about dupilumab efficacy and safety in moderate to severe uncontrolled asthma. Asthma is an inflammatory disease of the airway to the lungs. It makes breathing difficult and can make some physical activities difficult or
Asthma
even
is a
impossible.
lung disease that inflames and narrows your airways. Normally, as you inhale, air moves freely through your trachea or windpipe, then through large tubes called bronchi, smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your bronchioles expand when the air is warm, moist, and free of irritants and allergy-causing substances called allergens. When air is cold or dry or contains irritants or allergens, your bronchioles contract. If you have asthma, your airways are frequently inflamed and swollen. Certain substances can cause your inflamed airways to overreact even more, resulting in an asthma attack. Triggers of asthma attacks are slightly different for everyone, but usually include outdoor irritants and allergens, such as pollen, smoke, pollution, and cold weather, indoor irritants and allergens, such as mold, pet dander, dust mites, and cockroach droppings, food allergens, such as fish, shellfish, eggs, peanuts, and soy, and conditions such as respiratory infections, stress, strong emotions, and exercise. The symptoms of an asthma attack include coughing, wheezing, shortness of breath, and tightness in your chest. During an asthma attack, also known as a bronchospasm, the muscles around your airways tighten, and the airway wall becomes more swollen. Your airways also produce thick mucus that narrows them even more, making it hard for you to breathe. If you have asthma, your doctor may prescribe medications to reduce inflammation in your airways, constriction of the muscles surrounding your airways, or mucus secretion in your airways. During an asthma attack, you may need to use a short-acting rescue medication called a bronchodilator. This medication causes your airway muscles to relax quickly and provides symptom relief within minutes. Since there is no cure for asthma, the goal is to prevent you from having asthma attacks by using long-acting anti-inflammatory control medications. If you take them every day, they will reduce the inflammation of your airways, making them less sensitive to triggers of asthma attacks.
Applications in medicine. For asthma, we use rescue inhalators and nebulizers, which are used with medicine that need to be inhalated deep into the lungs. Bronchodilators, which work to relax the tiny muscles in your lungs. Anti-inflammatories, which target inflammation in your lungs that could be preventing you from breathing.
Hi, I'm Dr. Rana Ziadeh. When it comes to taking care of asthma, there are 3 things that are very important. Always have your medicines on hand. Know how to use your medicines to control your asthma symptoms. Know how and when to get help when you need it. Working with you as a team, we at Children's Hospital of Pittsburgh and Children's Community Pediatrics can help you keep your asthma under control. Here's more information about what asthma looks and feels like from asthma specialist Alvin Singh.
If you're going to try to control your asthma, it's very important that you know what asthma is and what it looks and feels like. So let's talk about what happens when you breathe. You breathe air in through your mouth or nose, it goes down your windpipe or trachea, and then to your lungs through various sized airways. In asthma, a trigger of some sort causes the airways to become inflamed, swollen, and filled with mucus. This causes obstruction of the airways, which makes it harder to get air in and out of the lungs. Your chest might feel very tight, as if someone is sitting on it. You may cough a lot and also have trouble keeping up with your friends during sports or other activities. You may also notice a whistling sound when you breathe, which is also called a wheeze. These symptoms can occur during the day or at night. Some people who have an asthma attack say it's like trying to breathe through a straw. Other symptoms include rapid breathing, breathing with the shoulders, and flaring of the nostrils. Smaller children can have rapid breathing as well, which can sometimes cause the skin around the neck and the ribs to be sucked in. Any child can have the symptoms described above with a cold. But if the same symptoms keep coming back more frequently, you should think of asthma as a possible diagnosis and see your pediatrician. Asthma can be brought on and made worse by different things. Allergies, which are accompanied by sneezing and runny nose, can also make asthma worse. Seasonal allergies can also make asthma worse depending on the time of year. Various allergens, such as dust, grass, ragweed, and mold, can make asthma worse. Other triggers, such as changes in weather, crying or laughing very hard, and the common cold can make asthma worse as well.
Hi, I'm Linda Earhart with the American Lung Association, Program Manager for Pennsylvania Asthma Partnership. I hope you found these videos helpful. For more information on how to stay healthy and gain control of your asthma, you can visit these websites, chp.edu or paasthma.org.
And cons of dupilumab. Pros: it can be used in asthma, dermatitis, and eosinophilic esophagitis. It's not contraindicated during pregnancy. Really helpful against severe and moderated asthma. Cons: can cause many adverse effects like conjunctivitis, blepharitis, oral herpes, keratitis, immunogenicity, neutralizing, and eye pruritus. In Ecuador. There are not studies about the use of dupilumab in Ecuador. Here, doctors still recommend other medicines. According to the Center for Disease Control and Prevention, CDC, approximately 27 million Americans have asthma. is the most common chronic condition among American children. 1 out of every child has asthma.
Atopic dermatitis is a chronic pruritic inflammatory skin disease with a major impact on quality of life. The current understanding of the pathogenic process in atopic dermatitis focuses on the Th2 immune pathway. Interleukin-4 and interleukin-13 are cytokines produced by the Th2 cells, mediating the inflammatory response. They downregulate expression of important genes involved in skin barrier function and integrity, and prevent upregulation of antimicrobial peptides in response to pathogenic stimuli in the skin. Unfortunately, patients with moderate to severe atopic dermatitis have limited treatment options to adequately control their condition. Dupilumab was approved by the FDA in March 2017 for the treatment of adults with moderate to severe atopic dermatitis whose disease is inadequately controlled by topical therapies. Dupilumab is a fully human monoclonal IgG4 antibody that binds to the shared alpha subunit of the interleukin-4 receptor, and therefore inhibits interleukin-4 and interleukin-13 signal transduction. By inhibiting the signal transduction, inflammatory markers of T-cell activation and epidermal proliferation have been shown to be downregulated, while barrier-related genes have been shown to be upregulated. We reviewed the results and the safety data of clinical trials to determine dupilumab's potential in the treatment of moderate to severe atopic dermatitis. In Phase 3 clinical trials, patients with moderate to severe atopic dermatitis were randomized to receive placebo, weekly or biweekly subcutaneous injections of 300 mg dupilumab as monotherapy or with concomitant topical corticosteroid use. Clinical efficacy was assessed by primary and secondary endpoints of Investigators' Global Assessment Score, or IGA, a measure of skin clearing, and Eczema Area and Severity Index, or EASI, a measure of severity. At 16 weeks, a significantly greater number of patients treated with dupilumab monotherapy and concomitant topical corticosteroid use had an IGA response of 0 or 1 and achieved 75% reduction in their EASI score compared to placebo. The most common adverse events with dupilumab treatment were injection site reactions and conjunctivitis. Overall, trials to date have shown a favorable and consistent safety profile. Dupilumab is the first approved targeted biologic therapy for atopic dermatitis. If it demonstrates sustained efficacy and safety in long-term studies, it will be a successful treatment option for adult patients with moderate to severe atopic dermatitis with previously limited options.
Conclusions. The treatment with dupilumab is new. Ecuador still uses other medicines to treat asthma. Dupilumab is really good to treat moderate and severe asthma.
More than 20 million Americans suffer from the condition known as asthma. But what exactly is this disease?
Asthma is a chronic respiratory condition in which a person's airways become narrowed, making it difficult to breathe. There is currently no cure for this disease. Asthma is typically characterized by coughing, wheezing, and shortness of breath. When allergens or environmental factors cause a spike in these symptoms, it is known as an asthma attack. During an asthma attack, the large airways, called bronchi, react to a trigger, like an allergen, with contracting spasms. The bronchi inflame and produce mucus, further narrowing the airways and leading to the symptoms of asthma. Attacks may last just a few minutes or can linger over several days. Symptoms can usually be relieved using asthma medications, but may also dissipate naturally in mild attacks. Asthma is not new. In fact, it made its first appearance in the Iliad, where the poet and author Homer coined the term from the Greek word for sharp breath. Centuries later, in 450 BC, the philosopher Hippocrates used the term to describe breathing difficulties and spasms that he had observed in tailors, anglers, and metalworkers. Today, doctors agree that there is a strong genetic component to asthma. However, it takes more than genetics to make a person have an attack. Environmental triggers are necessary as well. There are many different theories about which stimuli can cause asthma, among them early childhood infections, chemical exposure through air pollution, and insufficient immune system development. Once asthma does develop, exposure to certain factors called triggers spurs symptom flare-ups. People who experience symptoms after exposure to allergens like dust, cat hair, or even cockroach dust are said to have allergic asthma. Many people with allergic asthma also react to environmental irritants like cigarette smoke. Some basic medical conditions like colds, sinus infections, and acid reflux disease can also trigger symptoms. Vigorous physical activity and stress are other likely causes of an asthma attack. Serious attacks can be life-threatening. The good news is that people with severe asthma can often overcome or at least control their symptoms, even excelling at sports. Just look at swimmer Mark Spitz, who held the record for the most gold medals won in a single Olympics despite his asthma. And fellow asthma sufferer Jerome Bettis, formerly of the Pittsburgh Steelers, was a popular NFL running back. While asthma can be life-altering, with proper treatment, people living with the condition can lead very full, normal lives. If you or your child is suffering from breathing difficulties characteristic of asthma, please see your doctor immediately.
Want to learn more? Check out other videos and sources on this site for more information.